Okay, so the first in our series of clinical videos, we're going to discuss adjustment of a Binator appliance. When do we use a Binator? I like to use it not as an active appliance, but as a retention appliance, normally after phase one. Oliver here had a very deep 100% overbite, and we treated him with some upper arch development with some 2x4 mechanics, and we've opened the bite. Now, to maintain that overbite as we wait for full eruption of permanent dentition, I've asked Oliver to wear a Binator at home and at night time. The style of Binator is a Binator to open, which means it will have no acrylic in the posterior section so we can erupt the molars, and it will have an anterior bite plate effect. Later in the non-clinical part of this video, I'll be showing you the other two Binators, which are the neutral Binator and the Binator to close. But basically we're talking about class 2 individuals that may be high angle, maybe low angle, maybe neutral angle on their mandibular plane, and what keeps their jaw into class 1 as we're waiting between phase 1 and phase 2.
And what I'm going to do is check it, see if there's any wear on it. Basically, if there's any breakages, and make sure he's actually been wearing it. If it's brand new, as obviously he hasn't been wearing it, that looks to be pretty good. Alright, this in terms of design.
This is with the clinical fit, and then
so then put the binder, and there we go. And put that in, open. Clicks in beautifully. Chin up, buddy. That's good. And posture into it. Good.
So if we look at the design of this Binator, labial bow, which helps with our retention. One thing you've got to be careful of with the labial bow, if it's too active, you'll start losing torque on your incisors, and you can see we don't want that sort of div 2 appearance occurring here. You can see in the buccal segments here, there's certainly space for the eruption of the teeth, and we can trim that acrylic. In this case, that acrylic is coloured white. We can trim that acrylic in a mesio-distal direction that allows the molars to erupt and also erupt more into a class 1 position. You can see the incisal capping, belts and braces approach. I have acrylic as well as ball clasp, much like the twin block appliance would be. The second thing, when you fit one of these Binators, you've got to make sure that the acrylic is in contact with the upper incisor. If there's a gap between the acrylic and the incisors will over-erupt, which is going to deepen the bite. So now you can see for the lower, unimpeded, allowing to erupt. When you see the Binator to close, you'll realise that we have acrylic here, because I want the incisors to erupt, because it's an open bite. The neutral one will have acrylic here and acrylic there. Now this is the American style Binator. In Europe, they use more the Baltus style. The Baltus style, this labial bow will bend back and around itself, giving what's called a vestibular shield. I like the vestibular shield because it prevents the cheek from rolling in when you're trying to erupt the teeth. So this is the American style Binator to open. It will have incisal capping for the deep bite, labial bow, and retention element, which you can see here. I'll see when I take the appliance out, you'll see it a bit better. But you'll have a clasp, Adams clasp, and you'll have a ball clasp, so that makes it very retentive. And in the lower, just in the terminal molar, we have a C clasp, much like my twin block design, where we have retention of the lower. In the same way, we have a C clasp at the back of this appliance.
So pop that up.
You want to take that appliance out there? So now you can see the appliance outside of the mouth, and well, let's talk about a couple of things. Here, Coffin Spring allows us to get expansion if we still need it, just by activating, and I'll show you how to activate that in a moment. You can see that we have a bow which we can change torque of our incisors. We have the labial bow, which gives us our retention. And if it's a Div 1 and I want to detorque the incisors, I'll activate that loop. If we look then on the retention of the upper, you can see here your delta class. I much prefer delta to Adams. Why? The Adam class, more chance of fracture. Delta class, the class is bent with the metallurgy of the wire, so there's less stress areas. Here's your ball class. So the delta class, the ball class, the labial bow, all about retention. The inner bow, all about controlling your torque. Same with the outer bow and your coffin spring. Now if I turn the appliance around the other way, so now we're talking about the mandibular side, you can see it's pretty plain and simple. Here's your retention, which is your ball class, and there's your terminal C class. And the terminal C class really helps this appliance stay in at night. Some of the free-floating binators, as I call them, I've had major problems with patients with retention, appliance falling out at night, etc. This is a nice design that basically locks the mandible in the position I want as I can control eruption of the teeth. Now let's talk about controlling eruption of the teeth. Can everyone see the grooves here? This is what we adjust every visit. Basically, the appliance is put in the mouth with articulating paper. The patient bites into that, and then we can see where the contact points are. And we judiciously trim those contact points such that we're encouraging the lower teeth to erupt vertically and mesially. The eruption of the teeth vertically and mesially allows us more class 2 correction, more vertical correction. Got anything else you'd want to add about that before we maybe go through adjustments?
That's very good. Just how to activate.
So activation, if we talk about expansion, this is a standard universal plier Jarraback. If we go back to our wire bending videos, I talk about this as being the light wire plier, the half round, the universal. I know it really as a Jarraback. So as we get this Jarraback plier and I press the omega loop, that can give me expansion. If I want to constrict the arch form, then again I'm activating the loop on the other side. So 3 points of activation, here, here, and here. As far as retention, the best way to tighten the class is to get the half round plier, place it just before the loop and activate it like this. That gives very good retention. Ball class, same story. It can be right up at the ball, or more than likely it's going to be where that class enters the embrasure of the tooth or the contact point, and then again we're just activating that to make it more retentive. Labial bow, if I want to detorque incisors, then I will grab my loop and press this way. If I have too much torque, in this situation we're losing torque, it's becoming a little bit Div 2, I'm going to press here and open the loop, and I'm going to activate the inner bow. And activation of the inner bow is a very simple task by pushing forward. So in this situation we will activate the inner bow, release the outer bow, because we are detorquing the incisors. He's wearing this appliance so well that the upper incisors are becoming a little bit Div 2. If it was the opposite, proclined incisors, I would release on here and activate on there. So Con, some more activation tips?
Yeah. Just to activate the omega loops, put your little bird beak into the omega loop. Okay, so we get the omega loop and we activate towards the undercut of the tooth, which will be gingival this way. So we go there, into the omega loop, grip it, and we roll it in like so. And then on the distal, do the same, like so, and want to activate it this direction. Again, from side-on view, you can see it's activating in the gingival direction, thereby embracing the undercut a little bit more firmly. C-clasps, you can see from this view, if we need to activate, we will just simply, like a denture, tighten this way. Or possibly even more gingival, so if it needs to engage the undercut if it's gingival. Wall clasps, less is more. You don't want to move these too much. You want to get your little jaw back like so, and you only need very minimal movement here to actually get the retention being a lot tighter. Otherwise, if it's too tight, it might not seat, the appliance might not seat. And you so limply grab here and then in. That's about it. The labial bow, I'll look from side on here, as Derek said. We activate like so, by pulling the labial bow more lingual. Also just be careful about deep torque incisors, in which case I reverse the bend by pulling back this way. You can see that there, so we go pinch once and draw back this way. So when it goes in, get the patient's posture into it, and make sure we look at the incisal edges and make sure they're all seated correctly into the acrylic. And now if we want to erupt teeth, Derek, we want to deepen the bite, we trim the acrylic pads on the uppers, and the posterior is already there close. Lock it that. Right.
I'm just going to show the original malocclusion to where he is now. Just open nice and wide there for me. Good. And open really wide. Bite together again. Close together. Good. Bite on. Bite normally. Normal bite. Yeah. So if you if you have a look at his bite at the moment, when he started, and I'll show you his original photos and his original models, he had 100% overbite complete to the palate. So this is a great way, while the child's still growing, to open the bite. Before we consider going to phase 2, you can see he's got peg lateral incisors, and so normally what I like to do is work in conjunction with my prosthodontist and periodontist, maybe doing a gingivectomy, bonding off that lateral with composite before we actually bracket the case. The prescription I'd use in phase 2, high torque upper, low torque lower, light class 2 elastics from the Go-Get. The elastics are really going to be to erupt the posterior dentition. So once we've expressed torque and then erupt the posterior teeth, I'd change that to more of a box pattern elastic in the buccal segment. But effectively, this is phase 1, bite opening, waiting now for full eruption of the second molars to consider a phase 2 treatment plan. This is one method of taking the bite. This is what we used in Oliver's case. It's a Projet. It's the blue Projet. Blue Projet gives you the right amount of opening for a deep bite. We use the yellow Projet if we're doing a open bite, and I'll talk about Binators to close in a moment. And you can see the main thing is I don't want any wax in that contact point, because if wax falls into that contact point, we have the problem of having artificial positioning on the articulator, which is not going to be an accurate fit then in the mouth. Now, if we look at the original malocclusion, and again, we can see where Oliver started, 100% overbite, mixed dentition, very, very deep. In the past, this would be left to treat in permanent dentition. In permanent dentition, very hard bite opening mechanics because of the brachyfacial jaw pattern. What we've done effectively in phase 1 is open the bite, and makes it much easier for us to control our mechanics. Little tip for you here, when I present a case to patients and their parents, they always want to know how many baby teeth are left. Just a tip, we fluoro the baby teeth on the model. Makes it very easy for the patients then to, and the parents to understand what is happening. And in his case, we started him in a mixed dentition, what the Americans would call 2x4, 2 molars, 4 incisors. You can see how small his incisors were there before full eruption, and you can see the very deep bite. And if I look, can you just turn your head that way for us, Oliver? Thank you. You can see the classical brachyfacial jaw pattern. These are the patients who are going to be the bruxers, who are going to have the mandibular tori, and your biggest problem is in an adult, trying to extrude teeth with that sort of musculature is prone to relapse, because as you're erupting the posterior teeth, his muscles are intruding. So that's why you want to treat the child during growth. Oliver's had a big growth spurt during his first phase treatment. That's certainly helped us. It's corrected the class 2 and it's opened the vertical dimension off the bite. So I thought we might ask Oliver, as the patient, what his experience has been of the Binator and the 2x4 mechanics. So Oliver, what do you think about wearing this plate?
It's easy to wear, and well, it stays in at night, and it's pretty comfortable. Yeah.
And how often do you wear it?
Every night, most of the time. Yeah.
Good man. Ideally, in end of phase 1, what I'd like the patient to do is to put the appliance in as soon as they get home from school. They then take it out when they're eating, brush their teeth, back in their mouth till the following morning. So that protocol, which is about 12 hours a day, really helps retain the changes we did in phase 1. Oliver, what about when you had those 4 braces on the top and bottom teeth? How did you go with those?
Yeah, it was okay.
I think you had a really deep bite, and we had to put some of that putty on your back teeth, remember? So that way when you bit down, you wouldn't break off your lower braces.
Yeah.
Right. So anything else you want to say about your appliance?
No.
All right, so I want you to keep wearing it like you have been, doing a good job, and then I'll see you again probably in 6 months' time. But between now and then, if it's not fitting properly, it's falling out at night, you come in early and I can adjust it for you. Okay? Thanks very much for coming in today. Okay, so we're looking now still on the subject of end of phase 1 class 2 correction, and just showing you this Binator on this typodont, and we can see some similarities to the clinical case. Here we have 2 wires which allow the movement, and I'm just opening these wires up to show you how I can use the 2 Z springs to torque my incisors, which would be important in Oliver's case. Again, here's your Coffin Spring. Here's your acrylic, but you notice how this acrylic doesn't have any ball class. I find that can sometimes be a retention problem. The other problem with this design, you can see in the upper, no Adams class, no Delta class, no ball class. So again, this is a free floating appliance, and I've had quite a few problems with patients with retention with this appliance. But again, looking at how we erupt the teeth, you can see the teeth are discluded so that you can trim the acrylic. I try to convince patients not to choose blue as their colour for the Binator. Why? When I use articulating paper, it's next to impossible to see where the marks are, even with the red paper. Difference in design here, if we look from the mandibular view, you can see you can add, if you want to, a midline screw. That helps with retention, also helps with development. But if you are going to do that midline screw, obviously you'll need your acrylic cut down the middle. So if we are asking our lab to place a midline screw, we can't place it in the upper. We have the Coffin Spring for that, but we can place it in the lower, and sometimes that helps my lower intercanine distance. Remember, you can't expand the mandible, but before the eruption of the lower canines, you can do some alveolar remodeling and allowing those canines to erupt in a more buccal arch form. I'm going to put this back on the typodont to again show you why this is a Binator to open. No acrylic posteriorly to allow the molars to erupt, but acrylic right to the incisors anteriorly, giving you a bite plane effect. If this was a neutral Binator, you'd have acrylic here and acrylic there. If this was a Binator to close, or an open bite Binator, then you'd have no acrylic here, but only posterior acrylic. The posterior acrylic you would not adjust because it's giving you the posterior intrusion, and you would encourage active extrusion of the incisors. Now the only problem with that design will be because of the open bite, the tongue will want to sit in there. So for the Binator to open, what we'd like to see is some class to prevent tongue thrust. And that's really the three designs. So we're talking about Binator to open, Binator to close, and neutral Binator. Let's design this for our lab. And what I like to do is start with my class on the 6s. Then we have our labial bow. I like to put one ball class here, and that can be used both in the mixed dentition and permanent dentition. You can bend that. Also in our upper design, remember, we can also have the Coffin Spring, and we can have our two Z-class wires. Z-class wires wrap around here, wrap around there, to allow us to move the incisors at will. Our expansion component with our omega loop can be placed there. Now let's look at the lower. In the lower, I like to have ball class. We then have the acrylic capping on the incisors. The last tooth, I put a C-class, which I showed you on the video. But then in this design, we're leaving the acrylic so that these teeth can erupt. If I think it's going to need development, I will ask my lab to put an expansion screw here, and they know if I put an expansion screw there, they're going to have to cut the acrylic in the midline. So this is called a Bionator to open. Yep. Now let's talk about the other design. This will be a Bionator to close for open bites. Now in this situation, I don't want to have any acrylic here. Where I do want my acrylic is in the buccal segment. So we still have our labial bow, which is for retention. We're going to have our same class for retention. In this situation, I'm worried about the tongue going forward. So what we'd like to have is some design to prevent the tongue from going in between the incisors. In the past, I would put some tongue cribs here in the upper part. But what that actually does, that encourages the tongue to go downward and forward, which is what we don't want. So nowadays, I have a different design. We will put a hole here, because that's where I want the tongue to go, behind the palatine rugae, almost like a Morales style. But in the lower, I will have the class coming here. So the tongue is not comfortable sitting here and going forward. This is very much a Frankel design. Frankel realized that to get development of the upper arch, you need to have the tongue on the palate. So his Frankel appliance has minimal acrylic in the upper and has factors in the lower to prevent the tongue from sitting there. So in the same way, we're encouraging the tongue not to sit in the mandible, but to sit in the maxilla. And the incisors, as you can see, we do not have any acrylic here or here, so that the tongue is, so that the teeth can erupt. The teeth can erupt towards each other. Sometimes if you want to help that, put some buttons on the teeth with anterior elastics. In this design, to erupt the posterior teeth, you would use buttons on those teeth with class 2 elastics to the labial bow. So binator to open, binator to close. Last one known as a neutral binator. Now, neutral binator basically has features of both. Neutral binator, we're not really trying to change the vertical dimension at all. In a high angle case, we don't want the molars to erupt, but we want the incisors to erupt. In a deep bite case, we don't want the incisors to erupt, but we want the molars to erupt. In a neutral binator, we're effectively placing acrylic in the buccal segments, as well as acrylic incisal capping. So the retention of these appliances is the same. That's a standard factor, which is again labial bow, delta class, ball class, acrylic posteriorly and anteriorly, neutral binator.